McCarthy, and I am with the Community Clinic Association of LA County. We represent 42 nonprofit community clinic organizations across the county that operate over 127 sites and see nearly 1 million individuals each year who are uninsured, underinsured, largely from immigrant populations. 72% of the folks walking into the clinic doors across the county, clinics like Clinica Romero, are under 100% of the federal poverty level. These are working poor. 63% of them are uninsured. So these folks are coming in, and the clinics are seeing them regardless of ability to pay, because that's the mission. That's going to happen, healthcare reform or no healthcare reform or great healthcare reform or pretty great healthcare reform. The clinics are still going to stand for the same mission, which is to see all and to serve all regardless of ability to pay. Now, what happens when suddenly the ability to pay changes with healthcare reform? That's why we're very excited with some of the stuff that's coming through in this legislation. There's so much that we've been hoping for a very long time, in particular with the economic crisis and the real challenges at the state level, where clinic funds have been tied up in budget messes and battles, where programs have been slashed, and the demand for services has just grown and grown and grown. A quarter of new clinic patients walking in the doors have become uninsured in the last year. So this is the reality that the clinics are living with. When you look at the impact of the healthcare reform legislation, one, it's the expansion of the Medicaid program, Medi-Cal, here in California. So everyone, and this is so marvelous, under this legislation, under 150% of federal poverty level would get access to the Medi-Cal program. Now that doesn't include the undocumented, we understand that, and that's unfortunate. But luckily here in LA County, our county has made a commitment to ensuring that folks have access to care. And there's a patchwork of other programs, such as the Section 330 program, that gives community clinics and health centers grants to offset the cost of services that are not reimbursed. What does healthcare reform do? It cuts in half the number of people who are coming in without insurance. Suddenly folks are walking in and they actually have a payer source, which eases up some of the clinic resources. Clinics who are holding fundraisers and bake sales and you name it, trying to figure out how to pay their bills, they're suddenly able to stretch that dollar a little further and actually enhance the services for those who continue to come in without insurance.